So getting a good night's sleep is everyone's goal, but if you snore, don't feel well rested, or you fall asleep during the day, it could be a sign of a bigger problem.
Yeah, here to explain some treatment options in your community for sleep apnea. Carle Medical Supply. We've got Katie Davis and Rhonda Meyer. Good to have both of you here. Thanks.
So I guess let's first talk about what is sleep apnea. What does that mean?
So that's a diagnosis that can come from your primary care physician or your sleep provider, and you obstruct or stop breathing while you sleep.
So if someone has sleep apnea and they stop breathing while they're sleeping, there's a machine that can actually help. So let's talk about the CPAP machine and what it is.
Okay, so CPAP stands for continuous positive airway pressure, and it is a device that helps you breathe at night to keep your airway open so the oxygen keeps pumping through your body. That's very important when we sleep.
And, oh, go ahead.
How common is sleep apnea? Any sense of that?
It's pretty common.
Yeah?
We see quite a few patients. We can see up to 40 new CPAP setups a week.
And what do they say when they come in? Is it just like, I'm not getting any sleep, I'm a zombie? Like, what are the kind of the signs that, hey, maybe I need to go talk to somebody about this?
Yeah, so when they've seen, or when they come to us, they've already been seen and diagnosed. So they're getting that intervention and that therapy. And most of the time, patients are really all about their sleep therapy. They want to have a better night's rest. Some of them are a little more hesitant to want to wear a device because it is kind of something different and they're having to get used to it.
And I've seen, I've had friends on Facebook who have little ones who have even benefited from a CPAP machine. So it doesn't discriminate against age, does it?
It's a little bit more rare as the younger you are, but older you are, and if you're heavier set, that can be a role in that too.
Interesting. All right, so we're looking at a little bit more information about what a CPAP is. As we mentioned, you can wear it at night. It improves your breathing, and obviously the end goal is better sleep. So let's talk about why exactly people need better sleep, because there's actually some data on this. It's not just good sleep. I mean, that's important, right? But what other reasons, why else would people need a CPAP?
The CPAP obviously keeps you breathing at night. It's important for your heart to get oxygen to pump it out to your body. It helps with heart conditions, diabetes, all these different conditions. So if you are diagnosed with sleep apnea, it is also going to help snoring, which not only helps the patient sleep better, but it also helps the partner sleep better. We get a lot of complaints in that area. So a lot of couples have started sleeping in different bedrooms. So, you know, they can share the bedroom again with the CPAP so the snoring stops.
Yeah,
and most people that come to you to get the CPAP have done like a sleep study before. Is that how you're diagnosed? Is that the only way to get a CPAP machine is through a sleep study?
That's not the only way that you can be diagnosed. They're doing what they call home titrations at this point in time, where you start with a CPAP. It'll give you a range of pressure. You wear it for a certain amount of time, and you get the average of what your pressure should be set at.
Is this something that you could ever like grow out of and not need anymore?
More than likely you'll need it, but if you lost a significant amount of weight, you could be reevaluated to see if you still have that obstructive phases while you sleep.
So what exactly do you guys do? Obviously, they can get the CPAP from you guys. Is that it? But it's not that simple, right? It's not a one-size-fits-all, and you need to learn how to use that, right?
Right. So after your sleep study, the provider sends an order over for a prescription for a CPAP, and then we start gathering. We do a lot of the background legwork for the patient to get everything approved and authorized through their insurance before they even come in, so they don't have to worry about any of that.
That's great.
Yeah. Then when they come in, they will meet with a respiratory therapist. Some appointments are one-on-one, and we also offer CPAP classes depending on the patient's needs.
So Carle is actually celebrating some success with this, right? The Midwest region compliance, we hear. What is that?
So the device we use is the ResMed system, and they track average compliances, and in the Midwest region, which is where we are, it's the highest in the nation. And then for Carle Medical Supply, we even are above that national average of compliance for our patients.
Very cool. And obviously there's lots of health benefits to using the CPAP machine. Better sleep, more alert during the day. I know my son has asthma, so this would be maybe something that I should look into for him possibly.
Potentially, but if you're worried about your sleep, you can go to carle.org and search sleep providers, and you can take a quiz to see if you're at risk. If you are, you can talk to your primary care provider.
Okay. I love that idea. And always talk to your primary care provider.
Yeah.
And then they come see you and you get them hooked up, right?
That's right.
How to use it properly. Get the most out of the machine that you're going to be
And
using.
how to clean it. I've been seeing that on like commercials and Facebook. Make sure it's clean so you don't get sicker from using it. So
Yes, exactly.
Educate people on all of that too.
Yep.
All right, good information. Thanks, ladies. For more on sleep apnea and those CPAP machines, be sure to visit CILiving.tv.